Hey, we're back, folks. I'm your host, BKP, and we are at Circuit World here in Blue Ridge, Georgia this morning, and I have Dr. William Whaley with us, and it's time for Ask the Doc from Georgia Cancer Research Center, affiliated with Northside Hospital. How are you this morning?
I'm doing good. You know, we got costume changes.
Look at him. Look at him.
Okay, we have costume changes. You're wearing your leather jacket. You usually have a shirt.
Right.
Why am I wearing this?
I don't know. I feel like maybe some kind of exams.
No.
You got to go to work.
I'm going to work.
You always go to work.
I'm going to work, yeah. No, actually, I took it home last night. If I don't put it on when I leave it at the house. I have to call my wife to bring it to me. So that's saying that my memory might not be as good as it should be. So this reminds me to wear it to work. Because one of our questions
today... The concern I have is when it reminds you to go to work.
Yeah, but wait, where
am I supposed to go? Oh, that's
right. I remember now. Because one of our questions, comes up from a thing we discussed a week ago, which makes me think that the audience either was so impressed with the topic that they wanted an update, a bigger update, or I failed to put on the info good enough for it to sink in, because it's a follow-up question. And this way, there'll be more authority to it, and maybe it'll stick better. How's that?
Well, that's good. All of the subjects at any time, we're so limited. There's always so much more or different things that we can discuss on the subjects, and I appreciate you.
And let's go back and talk about Alex Trebek.
Yes, I appreciate you doing the research. Dr. Whaley does the research. Even if it comes up as the same subject, he does the research. He brings everything about it. But I do want to go with that. The game show where most of Americans, now some are better than others, but the game show where most of Americans, famous line is when watching. Let me ask this. You're always asking me a test.
Yeah, I can't.
Here's yours. When watching Jeopardy, what is most Americans' famous line watching at home? What do they say the most?
I have no idea.
I knew that answer. after it's revealed, I knew that answer.
I thought it was I have no idea. I have no idea.
Well, there's both. I get two things on that show. I got no idea what the answer is, or yeah, I knew that answer.
Well, you know, they had a guy on last night on Tucker Carlson doing the news quiz.
Okay.
Opposite Gutfeld. And this guy had won $400,000 and had done 18 wins in Alex Trebek. So he had him on there to honor Trebek, which was good. And Gutfeld beat him. Actually, and Gutfeld beat him because that guy knows everything there is to know about stuff, but not what happened this week in the news. So you know what happened this week in the news, although you may not know what the first king of Greece was. So
exactly,
it's okay not to know Jeopardy answers.
But our talking about Alex Trebek, he came out this week on his program, announced that he has stage 4 pancreatic cancer.
Pancreatic cancer, yeah.
And said he's going to continue to work and he's going to fight it and has all the right attitude, okay, towards it. And he came out and he knows people watch him, so he shared a very personal thing in his life with you and I. But kindly tell us what did he actually tell us as his audience?
90% of pancreatic cancer is diagnosed in stage 4. There's no PSA test, no mammogram, no colonoscopy for early diagnosis. It used to be that the average survival of a patient with pancreatic cancer was 6 weeks to 6 months from the time of diagnosis, even if you had surgery. Now we have much more effective chemotherapy, and there's a very strong possibility that given aggressive chemotherapy, he'll probably have to wear a wig, or he'll just show up there without hair, that he can go into a remission, but survival beyond 2 years is real small. So you'll have the opportunity to watch him like you watched, Steve Jobs and the movie actor that had pancreatic cancer. I forgot what his name was, used to play in Westerns. Rally for a short while meaning 3 months, 9 months, 12 months, and then he'll probably have to quit. Now, if he stays around for several years, it's a miracle of modern therapy.
So just 2 weeks ago on the show, we covered entirely pancreatic cancer,
right,
and you actually showed graphs it pictures on the screen, and you said at that time that to catch it in early stages, we just don't really do that.
Right. As I said, we do,
but it's highly likely.
Yeah. How you usually do is a guy has a kidney stone, and while they're doing the ultrasound for the kidney stone, they find something in the pancreas, or so they weren't looking at the pancreas. Or they have a gallstone and they find it in the pancreas. So they're looking for something else and the pancreas shows up. Because if you wait until the pancreas shuts off your bile duct and you have painless jaundice, or until it causes pain, it has advanced beyond that thing small enough to go in there and get with a surgical procedure.
We want to thank you in our first question, because we are telling our people out there that for the doctor to give you the best answer or most accurate answer, your sex and your age is very important in the question. So our first question here, I recently had a routine follow-up with my dermatologist from a benign small growth I had removed last year, and they found a dark odd-shaped mole which they removed and sent to pathology. I am a 59-year-old woman, and I have never had any skin issues which appeared to be possible cancer. So what are the odds of developing a melanoma, and is this the most common kind of cancer diagnosed from mole? Well, we just showed the odd shapes, the shapes, and everything. We just showed that.
Yeah, that was a week ago.
Right. About a couple, maybe a week ago. But we just showed that. But let's address this question.
I think it's a good question, and I really don't feel that I did cover it well. But there's several things here. First, at a benign small growth a year ago, and is back in the dermatologist's office. So that tells you, one, they got good advice, is that you had a skin lesion, you should have periodic skin inspection, even though the prior one was benign. So the patient has a little bit of misunderstanding that it never had any indication of possible cancer, because that one that was previously removed that wasn't malignant yet is in the family of things that can become malignant. And that's why that dermatologist put them on regular follow-up. Two, this age group, 57. So this, 57? No, that's the other, yeah, 59. So this patient's 59 years old. She was a teenager and adolescent before sunscreens were in suntan lotion. So she's in the South. We're going to make the assumption she was out in the sun with everybody else, putting baby oil and iodine on there to accentuate the sun, and so she really has risk for the development of melanoma, because she was an adolescent and young adult living the normal lifestyle. She was in the sun before sunscreens were on there. What they were trying to do then was turn the color of this thing instead of staying white, protecting their skin. So the risk of developing melanoma is significant. Okay, show the first one. I'm doing this as a joke here because we talked about moles last week. So our first, like that.
Moving right along.
Moving right along. Okay, so here is the second one. Here there's a few things that we didn't bring up before. And this one right, you see the little thing, ugly duckling. So we didn't talk about ugly duckling last time. This is a patient that's got, and they're talking about self-check here. So this is a patient that's got a lot of moles, and these moles all look the same, and that mole looks different than the other ones. So they used to say, if you walk like a duck and talk like a duck and found in the company of ducks, you're probably a duck. But that one right there might not be a duck, so that gets you into the doctor's office. And they would not look at that and say that it looks like this. Remember the melanomas, right, where they had the irregular surface and it had multiple
borders,
colons,
irregular borders.
Yes. Yeah, okay, so we'll put that one away. But that basically is, there's a lesion on the skin. It is different from my other lesions, so even if it's not ulcerating or changing and it's looking different, you got to go see the doctor. All right, now we're back to this. Is this the most common type of cancer diagnosed from a mole, is the end of the question. So yes, moles become melanomas. The ugly duckling, which is what she probably had removed before, was an actinic keratosis. That is a non-malignant And there are 10 actinic keratoses. If you got your glasses on, there are 10 of them right there. You see that? See all those? You remember you go to the doctor and he'll with that stuff and it blisters up and it freezes them. So that's probably what she had removed a couple of years ago. But sitting right above it, it says basal cell carcinoma. Right to the left of it, it says squamous cell carcinoma. Those are the things that develop from actinic keratosis. That's why the dermatologist had her come back. So what was found there that was different from these was a mole. This we are going to hope comes out to be what's called a dysplastic nevus. You'll remember we talked about that. That's a typical mole that's not a melanoma, and they're going to be in and out of that doctor's office every 6 months, every 3 months, or every year. So we'll go to this last one here before we run out of time talking about other stuff, and that's got that graph. It is absolutely true that there is melanoma is on the rise in terms of diagnosis. It's on the rise in terms of diagnosis primarily because beginning, let's say, in the 1940s, leisure time for young people and adolescents began to rise. But in the 40s, 30s, 50s, young people, listen to me, mama, listen to me, daddy, young people worked. They went to school, they came home, they worked around the farm, they worked around the house, they had the job at the filling station. They didn't go out by the pool and lie down like that. I was talking to somebody the other day.
They pulled the string on the lawnmower.
All right, pull the string on the lawnmower.
Don't want you to forget that one.
That's right. And up here in this part of the woods,
one of my category in there.
That's right. I cut grass, but up here in this part of the country, if you talk to these older people, they actually work year round, you know, in school breaks where they could go out and farm. They could harvest in the spring and plant in the fall, or what's the other way around? Plant in the spring and harvest in the fall, and then the summer break was. I mean, that wasn't. They didn't go on vacation. If they went to vacation, they went over to Savannah for 3 days with their daddy in the truck, and the rest of the time they worked. So anyhow, now there's all this leisure. Those people are now in their 50s, 60s, and 70s. They've been out in the sun too much. And so if you look at this chart has ages, so that you don't start seeing melanomas at any great age. They won't be able to read this, but where that thing begins to peak up, it peaks up at age
55 to 59.
What'd she say she was? 59.
Right.
So the question was asked, like they set this up, wasn't it? But asked by a 59-year-old woman who's right there on that point of the graph where, bang, that thing's rising like a rocket. So one, what we've learned from this question is, oh, and lastly, she left one thing out. She didn't tell us what the pathology report was. It may be she's still waiting for the pathology report to return. One, the doctor did the right thing a year ago when he had her come back. Two, the mole is going to be different. Yes, that melanoma is the most common thing that comes out of the moles, but it's not the most common thing he's going to find over time as he treats you. And lastly, she was 59 years old when she asked the question, and the incidence of melanoma diagnosis starts rising like a rocket at age 59. So it was a good question.
Well, you know, and I think what was important in that question is we got the timeline. Something that happened,
didn't she?
Right,
Yeah.
49 years old and the sex. 59.
So she did a better job than some of the other questions we've had asked.
Absolutely.
They didn't give us the age. They didn't give us a history. The only thing she left out was the path report, and I've got the feeling she's sitting around waiting for the path report.
Well, somebody's listening because the next question we have an age and a female. So you ready for that one?
Yeah, sure.
Okay. I am a 47-year-old. First of all, let me say this. Thank you very much. I want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, bringing us this segment this morning. I am a 47-year-old female. I have never suffered from arthritis or had any broken bones. I exercise by walking, and I'm not overweight. Lately, I've started experiencing very sharp pain in my ankle when I am walking. when I'm walking, these are sudden and sharp pains which prevent me from putting my entire weight down. The pain is intense and random and only happens when I am walking, never when I am sitting. I have experienced pain in my knee as well, but only if I try to squat onto the floor. This is a sign of some sort of joint disease. What say you, doctor?
Yes.
47, but not overweight.
Yeah, anything else? Well, yes, that's joint disease. No doubt about that. All right, okay, let's begin because it's kind of interesting. Number one, we know this is a fit, normal body weight walker. She's trying to do the right thing, right? Okay.
Not overweight, 47 years old, fit.
And she fit and she walks. Okay. Let's go show that first one. I'm gonna forgive them because everything that's around the ankle isn't a joint problem. Okay, so the first thing that I've got shown up there is the common things that happen in the foot and ankle that a person would say, oh, this is my ankle. The real common thing that would hurt with walking there, you see Achilles tendonitis right there?
Yes.
All right, so this big old muscle right there, that's your calf muscle, gastrocnemius muscle for you medical people that are watching. It just, if you watch, it just tapers down. That up there you'd call gristle. So that gristle in the muscle just tapers down, and when it loses the muscle, it becomes the tendon, okay? And then the tendon inserts on the back of the heel. So you've heard of people that talk about having Achilles tendonitis or heel spurs or whatever. These are all not part of the ankle. They're part of the supporting apparatus that works the ankle, and their pain in that location will be quite common. Now, the joint itself is those bones that you see right there. So if you had arthritis of the bone, that really wouldn't, you would wake up in the morning and you would actually probably have pain in that would get better as you walk. Now let's go over to that next picture here, because we're staying away from the knee for a minute. Now, if you look at this one, the black spot we've got sitting right there is sitting on the medial malleolus, or this tibial bone. The ankle, as I just showed over there, is got two bones that do like that, and then the foot works in here. Well, the one on the outside is the fibula, and you hear these football players and basketball players that break their fibula and are back playing ball in a week or two, because that's that little bitty thin bone. They can go in there and run a screw through there, and the guy can go back to playing. High ankle sprain's another way of looking at that. But if you've got something on the inside with that, that's a big bone. It takes you a long time. So pain in that area right there would be much more functional, less likely to be temporary. Like, see, Achilles tendonitis, heel spurs, and everything else, in 500 years, who's going to know the difference? They are going to get better over the next 6 weeks or so if you rest them, do ice, do heat, take your Motrin or ibuprofen or whatever. But this can be an arthritis. Now, the fact that this patient's beginning to complain of pain when they squat tells you that they probably are also developing, just like here, arthritis within the knee. They are exactly the right age group. Arthritis is a wear and tear disease. This patient is at ideal body weight. These symptoms could occur in the 20s and in the 30s in most of our people today, and I won't mention any names or anything, but we have people here in the technical crew who are probably 50 pounds overweight, and then not you, I said the technical crew that are 50 pounds overweight. So if you imagine that you wake up in the morning and you put a 50-pound sack of sand on your back. But wait a minute,
stop. Yeah. But you can say technical crew, but I'm the one on the camera.
Yeah. We're talking about the technical crew.
And we know the camera had 75 pounds. Go right ahead.
Okay, yeah, camera does own 75.
All right. So, I'm sorry.
Okay,
but
it does. It does. I only weigh 140 in real life.
Go right ahead.
So anyway, what I'm saying is that this question is well written. because this age at 47, I'm going to go back to this because this is a concept that I have that it's very, very unique, I think, from a lot of experience. So you take a normal person who, when they graduated from college or they're about that age group, then over the next 10 or 15 years they gain 30 pounds or gain 40 pounds, which is very common. There are people in the audience out here that way. What you can imagine is that they're waking up in the morning, they got a backpack like all these kids do, and in it are 30 or 40 or 50 pounds of sand. They strap it on their back. And from the time they get up in the morning or they go to bed at night, they're carrying that 50, 60, 70 pounds of sand on their back. Now, you would not be shocked to discover that it wears out their knees, it wears out their ankles, it can wear out their hips, it can wear out their back because they're carrying that load.
Right.
All right, now, I call this type of arthritis age and activity-related arthropathy. So this means that it is related to the number of years you've got, and here you're a young guy, but as we get older, these knuckles here begin, that's just age-related. I ran 40 miles a week for 40 years, ran 19 marathons, and one wouldn't be expected. Next Friday, we can go today, this time in the morning, I will be coming out of the operating room with a new hip. I wore it out. I mean, I'm 79 years old, so that's age and activity-related arthropathy. At this age, 47, physically fit, being an exerciser, she is beginning to develop some arthritis or tendonitis of her knees and her ankles. It's not a bad thing. But then she needs to do some stuff. So there's physical therapy for strengthening your knees. She needs to go see her family doc up here at the top of the hill. You've got a lot of them, but there's one of them up there, Dylan Miller, for example. I think he has a particular interest. He's a young man and fit. I think he has an interest in people who've got arthritis. But anyway, there's lots of good family docs around here. They'd be able to tell you whether this is all soft tissue, tendons, and just going to go away with ice and heat and Motrin and so forth, or whether or not it's an arthritis that needs to be looked at by an orthopedist. There.
That works.
Good.
That works. And
all right.
So, first of all, thank you, Georgia Cancer Research Center, affiliated with Northside Hospital. Dr. Whaley, at this time, we always like to what is new in medical research and what is going on out there you want to share with the audience.
I want all the attention of all the people that work in here and the technical crew. And
you got my undivided attention.
All right.
Other than I will say there is a lady right there that I'm trying to keep my eyes off of.
I want you to read. I want you to read a headline. Read the headline.
Largest study ever finds no link between measles vaccine and autism. And here's the thing that's interesting. You go right ahead, but I got that one yesterday. Day before? Was it yesterday or day?
It was day before yesterday.
Yes.
This is the largest study in the world.
Yes.
600. I want you to listen to this over there. 650,000. Now, you know the Scandinavians have great records. 650,000 Danish children, vaccinated and unvaccinated, the rate of autism. So this is not, my daughter got a measles shot and had autism 4 days later. That's called anecdotal. This is a huge study. They not only there was no difference, but they then pulled out the people who have high risk of autism by study because they have a family member with autism, or they have a family member, parent with hyperactivity syndrome, or one of those things that would be expected in that family to have a greater incidence of autism, and in the vaccinated versus unvaccinated, no increase. So I'm going to read, first of all, I'm going to read just a couple of things, because first, the discredited link between vaccines and autism goes back 2 decades to a medical study published in the Lancet about a handful of children, 6, that had been diagnosed with autism within 4 weeks of receiving the vaccination. Okay, that's what all of the vaxxers say. The kid got a shot, he had autism within a few days or a few weeks. The guy who wrote that article ultimately retracted the article. Now, this is enough, but I'm going to read this paragraph. That would please the audience listen to, audience, Audience, listen to this. All right.
You know the one, the troublemaker.
The one that's not listening. All right. That no increased autism risk was found, even in high-risk subgroups, is not surprising. However, the anti-vaccine movement is not influenced by facts, by science, or by logic. So I fear that another study demonstrating the safety of vaccinations will not sway those whose allegiance is not to reality, but to irrational, arbitrary beliefs. Now, the people that should have listened to that were talking.
Okay. Did you, at the same time, see the young man, or get an opportunity to hear about the young man that testified before Congress this week that his parents did not vaccinate him while he was under 18, and as soon as he became 18, he went and got all of his vaccinations? He actually testified before Congress this week on a panel that's looking at vaccinations. So I just throw that in there.
I mean, that's a kid. The poor kid doesn't have a say in it.
We don't have the time. We got to get the all-star political panel on there because they're getting all chatty over there anyway. So we're going to have to get them in here. But I want to say this. That vaccinations I don't disagree with. I just do think there's some things medically that we do that need a couple generations of studies.
Oh, I don't doubt that a bit.
You understand? No. Before we see real outcomes. I don't think if you start a study at birth and you try something new, your study's complete. You may be on the right track until maybe that person has kids, and then that person has kids. You know, that's just my opinion.
You're right. Okay, I'm going to tell you.
Now, I'm not anti-vaccine. No. When I have my vaccines, I'm not going there. My parents decided we should have our vaccinations, and also
including flu shots.
And let's not, Dr. Whaley. Yeah, including flu shots. We'll throw that in. Oh, okay. Anyhow. But what I am saying is, I do think good studies like that are important. And I thank you for that. I mean, good studies.
Right, I'm going to give you a real quick story. When I went to medical school, I went there on a fellowship, a totally paid for medical fellowship where I did research for 5 years in the Department of Obstetrics. We were monitoring fetuses in utero for transplacental transfer of the stress hormone, adrenaline and noradrenaline or epinephrine, by monitoring those kids when the mothers were placed under psychological stress. And I infused epinephrine into the mother during labor and delivery and measured it in the urine of the kids at birth, first person in the world ever to do it. And that study was supposed to follow those kids through the end of college to say that the stress of the mother either did or did not imprint them for various things. Study was 5 years along when the idea of informed consent came along. You may not remember it, but in Jewish Hospital of New York, they were doing research where they injected cancer cells into patients without the patient's knowledge. And they had that syphilis study over in Alabama in the World War II area where the patients did not give informed consent. So the FDA said these babies cannot give consent to be followed to their adults, and their parents cannot consent for them. So the study ended early. So one of the problems with a study like this is they've got these kids, when they've done this immediate study, which is fine, but to be able to follow those kids for the rest of their life, some governmental agency will tell them they can't do it because the kids can't give consent to be followed to the end of their life, and the parents either. And so some good do-gooder is going to come in there and tell them you got to quit testing.
Got to stop the study.
Got to stop the study.
And we really need the generational.
And you really do need the generational
stuff.
So that was my point. You're right, but somebody will step in there.
You can't force the next generation to continue to study. I'm your host, BKP. We want to thank Georgia Cancer Specialists affiliated with Northside Hospital for this segment. Thank Dr. William Whaley for working on these questions and bringing all this information. Now, if you have a question for the doctor, you send it to info, I-N-F-O, at fetchyournews.com. Put in the subject line, Ask the Doc, and we will get it to him and get it on the show. Also, you know, as we said, give Dr. Whaley details, sex, age, details on your medical question, and that way he can actually zero down and focus a little closer to the question and get you the answers you hear only on this kind of show. Again, if you'd also like to watch these segments and send them to your friends, and if you'd like to hear about, you know, you're an Alex Trebek fan and what is stage 4 pancreatic cancer, we have an entire video that details that if you'd like to go back. And how do you find that? You go to FYN TV, Fetch Your News YouTube channel, hit the playlist, Ask the Doc, and it's labeled there. You'll find it, pancreatic cancer. Again, Dr. Whaley, thank you very much. You look as though you need to go to work.
Yeah, Ray Tidman next week, guys. I'll be getting my hip fixed.
Well, you always say, it's time we send it to Ray Tidman, so every once in a while Dr. Tidman comes in and we ask him those questions.
It's always got a joke.
Oh, always got a joke. Thank you very much. On the other side of this, the All-Star Political Panel, they're awful chatty this morning, so we'll see if they want to get chatty right after the commercials.